Welcome to the updated CTS Medications Learning Package. My name is Ole Olson. I'm a paramedic practice leader. Today we're going to talk about 3 new changes to how we manage controlled and targeted substances at BCEHS. The first will be an introduction to the new updated CTS policy. Second, we will discuss the procedure document that is being developed for managing controlled and targeted substances. And third will be an introduction to the CTS medication register. At the end of this, you'll be asked to complete a declaration of learning and sign off that you have read and understand the new policy and procedures.
Hi there, I'm Chris Naples, paramedic practice educator in Vancouver. Welcome to the Q&A section of this video, where we'll explain why we've made these changes.
Why have we updated the CTS policies and related procedures? BCEHS is required to abide by strict obligations set forth by Health Canada's Controlled Drugs and Substances Act, Accreditation Canada, and affiliated standards. Our old policy was outdated, had ambiguous language, and lacked important information surrounding key topics such as CTS audits and single-employee medication transactions. Led by clinical and medical programs, a review team including paramedics, managers, and directors from across the province assessed and revised the CTS policy and procedures to support patient care delivery role in managing controlled and targeted substances. We've strengthened the policy to provide more context and protection for paramedics and to ensure BCEHS is in compliance with our legal obligations. The new CTS practice procedures are easier to read than the previous standalone policy and provide much more guidance around roles and responsibilities, with the inclusion of several flowcharts for CTS critical incidents. Why have we introduced a new CTS medication register? Currently, several different versions of medication registers are used across the province. The new medication register for documenting all CTS transactions will simplify and standardize how these medications are logged, including daily shift in and outs, expired medications, medication discards, patient administrations, breakages, and audits. The register's design adheres to both federal requirements and best practice guidelines, such as having a bound book with sequentially numbered pages and 1 medication or concentration per tab section.
The new controlled and targeted substances practice procedures align the organization with Health Canada standards. This document also outlines the roles and responsibilities, auditing procedures, and provides an overview of the CTS register. Who do the CTS practice procedures apply to? The new CTS practice procedures apply to all operational BCEHS staff. It is a mandatory requirement that you read the practice procedures regardless of whether or not you are authorized to administer CTS medications. This provides information about your legal obligation to identify and report any breaches of the CTS policy, and that is not specific to any license level. What are some key changes being introduced? The new CTS practice procedures is a large document, and so we're unable to list every single change in this short video. It is your professional responsibility to read the new document and then complete the self-declaration at the end of the online learning package. Some important points to note about the new CTS practice procedures include: nothing has changed to the way we obtain or administer non-CTS medications, although the practice procedures state that these medications must always be in a locked storage area. UCs, including acting UCs and managers, have heightened responsibilities in the new practice procedures. The biggest change is an audit function for UCs with CTS medications stored at their station. Single paramedic register transactions are permitted in the new practice procedures. However, there is a strict process in place for transacting medications when operating in a single paramedic mode. When a single paramedic signs out a medication, the next dual crew to sign out drugs must complete an audit of all medication stock. The practice procedures now require weekly, monthly, and quarterly repository audits completed by UCs and managers. Additionally, staff and managers are now supported by a breach matrix, which clarifies how to identify and report a breach to the practice procedures.
Who will use the new medication register? All staff who are authorized to administer CTS and/or high alert medications. If you are a unit chief or manager who is not authorized to administer CTS, you will now have authority, according to the CTS policy, to access the CTS repositories for the purpose of auditing, ordering, and investigating wastage, breakage, loss, or theft. Where can the medication register be found? Everywhere that a BCHS approved CTS and or high alert medication repository is located. Commonly, a hospital and or a station. The register must always be co-located with the drug repository. What are some key changes being introduced with the new medication register? We've moved to a single register design with a separate version for ACP and CCP that will be located at both station and hospital sites. Entries into each register will remain similar, with patient administrations and wastage being entered into one of the hospital repositories, while shift change in and outs will be completed at station registers. The new medication registers now contain a tab for each individual drug. We acknowledge that signing an in and out entry for each drug may take a little longer. However, these changes are important for patient safety and bring BCHS into line with best practice standards and will reduce medication errors. The new registers will be audited on a weekly basis by the unit chief and on a monthly and quarterly basis by your district manager. What do I do when a tab on the medication register runs out of lines for a specific medication? When a drug section in the medication register is full, you'll be required to close off the whole book, transfer the balances of all drugs to a new book, and store the old book in a locked cabinet. The CTS practice procedures provided detailed instructions on this procedure. Will my unit chief or manager need to be present when a new register is commenced? No. This can be completed by any paramedic who is authorized to access the repository in question and who is able to conduct an audit of the safe prior to closing and starting a new medication register. Where can I find out more? Along with important new policy information, the new CTS procedures policy provides detailed instructions on how to fill out the CTS medication register. This section will demonstrate some common examples of completing transactions using the new medication register.
We acknowledge that the new CTS register and policies represent a significant change for the organization. However, we are confident that these changes will bring us in line with our Health Canada obligations.
From here, we ask that you review the CTS policy, the CTS practice procedures, and familiarize yourself with the medication register when it arrives at your station. Following this, if you could, fill out the self-declaration, and that will complete the learning package. Thanks very much for watching this video.